of the country for easy access to quality health care.
Adekunle Olayemi tweets, in advanced countries, health is not negotiable, but in Nigeria, politicians use it to campaign, and after that, abandon it. Every government must make it a priority, and it must not be taken with levity. And also, NHIS should be for everybody, not for some people.
And Professor Otabor says national healthcare should be fully integrative, conventional medicine with natural medicine.
And Chris Simeon, it's quite interesting, but if the poor or the less privileged are not benefiting from this plan, it means there is a disconnect. Well, Chris Simeon, apparently you're listening to what the guests have explained. This is, of course, intended to reach the poorest of the poor. That's part of the plan. So those are the tweets that we're accommodating at this time. Let's bring in Dr. Chris Otabor. Dr. Chris Otabor, let's have your take on the Strategic Health Development Plan Phase 2, along with the funding options that have been outlined.
Thank you for having me. I've listened to the Honorable Minister talk this morning, quite a robust plan. But before I go ahead, let me just give a brief historical background. At the twilight of the last administration, the former president appended his signature to the National Health Act, and a bill which became an act. And that document, for me, is the most important gift that any government has given to this country in terms of healthcare, because that underpins this plan we're talking about and the basic healthcare fund that we're talking about. Unfortunately, it took almost 4 years before before we got to where we are now in terms of implementation. But never late. It's always, better late than never. The plan is an overarching health plan that is supposed to draw in the resources of all the states, local governments, and development partners, as well as private sector, into one structure that would deliver health care to the Nigerian people, especially the poor. I see the enthusiasm of the Honorable Minister. He has done quite a lot of work, him and his team. But I have my worries, because this is not the first plan, and we must ask fundamental questions. Why did the other plan fail? Because he said only 1 or 2 of the goals of the former plan was achieved. Over 80% of the same people who midwifed the first plan are still very much around. And if we don't look at the bottlenecks closely, it will still fall exactly the way the last one went. For instance, we've lost 1 year already. It's supposed to be a 5 years plan. And we're talking about 6 trillion naira within this 5 years period. 1 year has gone, remaining 4 years. What have we achieved? That plan assumed that the National Health Insurance Scheme would grow by to include 30% of Nigerians. But you know what is happening with the National Health Insurance Scheme today. I mean, if anything, we have reversed progress. Less than 6% of Nigerians are insured in terms of the NHIS. So there are a lot of issues. Then the issues of coordination. The Minister of Health might be in Abuja, making his own plans. What about the state commissioners? What about the state governors? They may have political exigencies that makes them deviate completely from the plan. And because healthcare is in the concurrent list, it's not in the exclusive list, unlike the police force, the IG from Abuja can tell the commissioner of police what to do. But healthcare is in the concurrent plan, and the states, the sub-national governments are in themselves relatively independent. They can choose what they want to do. So this is a problem. Then the next one is budgeting. Last year, we know how much was budgeted and we know how much was released. Because the health plan assumes that whatever is budgeted will be released. And when the monies are not coming in from the budget, because the budget itself is also subject to the price of oil in the market. So there are a lot of, though I'm excited about the plan, at least we have something to work with. But there is a problem with, I have an issue with the possibility of achieving even 50% of the plan.
Honorable Minister, your reaction.
Well, let me thank him for his comment. They are quite genuine, and everybody will be worried because the real issue is implementation. One is to assure him that even though the former president signed the bill in 2014, it was never gazetted until almost the end of 2015. So there was a 1-year delay in getting it out. Two, we have spent about 2 years trying to make sure that this plan does not fail, and we do not plan to fail Nigerians. We've consulted widely. That is part of the errors of the past. Plan 1, inadequate consultation. Because we are also allowing states to modify the plan to suit their peculiarity. The challenges in Zamfara, they are quite different from the challenges in Lagos. Lagos can operate a PPP model. They can have health facilities manned by doctors from the teaching hospital down to health post. Zamfara may not be able to afford that. Sokoto may wish to have community midwives. So we are allowing some flexibility in terms of the implementation approaches. Two, we've also taken pains to develop the operation manual for the basic care provision fund in a way that we will also make sure that we can get it right. With respect to implementation, unfortunately for us, the country went into recession in 2016. We're coming out of recession, but we have assurances that the funding stream into health will improve over time. Let me also say that the challenges he mentioned about political will, we have it. Political commitment, we have it. Action, we will have action. In terms of the releases, health has done better than many other sectors in terms of the release. When we had the polio outbreak, the release was 100%. 100%. 9.7 billion. The first time in the history of this country that Nigeria will release the entire amount allocated for a specific purpose. So I think we are on the threshold of a new era. I'm quite confident, I'm optimistic that if we can maintain this trajectory, we will ensure that we deliver. We've also been careful in the estimates. As a person, the 30% reduction in maternal mortality is not what I will go for. I want to go for something higher. We are talking of reducing it from 570 to 400. Even by SDG goal, even 400 is still high, but we're trying to be modest. We don't want to overpromise. In the past, we overpromised Nigerians. We'll do this, we'll give you free food, we'll give you free everything. We're not doing that this time around. We are quite modest. And we believe that these modest objectives are achievable.
All right, Professor Otabor, thank you very much. Let's bring in again Dr. Jibril. That's the Niger State Commissioner for Health. You listen to Dr. Otabor outline some of the potential impediments to all of this. Now, at the subnational level, what are the likely responses to these issues? Earlier, you were talking about the fact that you now have aggregated the relevant structures, policy and plans, and so on and so forth. Yes, the health insurance scheme is being rolled out in various states. We don't know what the level of buy-in is into those schemes, and what the governance structure will also be for those schemes, so that the kind of challenges that we have had at the federal level do not recur. The primary health care, I cited examples of some states, that we had their commissioners. You were not on the conversation on that occasion, where we asked them, so look, what is the level of implementation? That was last year, though. Things might have changed. Reproductive health. We have had reproductive health experts on Good Morning Nigeria tell us that people have, like women who want to take advantage of facilities, have challenges with accessing the commodities. So how are state governments or subnationals likely to respond to the impediments of the effective implementation of this plan?
Yes, thank you very much. And yes, I've listened to all that have been said, and we appreciate all the comments and all the fears. But like as I was saying, looking at the Niger State government under the leadership of the governor of Niger State, Alhaji Abubakar Sadiq Sani Bello, the collaboration with the federal ministry, and I'll continue to say that, has put in certain kind of guidelines and structures that you need to have in place in order for us to be able to deliver and even get fundings. The focus from the national level is what we refer to as results-based financings or performance-based finances. Now, at the state level in Niger State, we have already established our state primary healthcare development agencies. We have had transfers of all the staff at the State Primary Healthcare Development Agency. And from the last scorecard that was done, we are second in the country in the implementation of the primary healthcare under one roof policy for 2018. Now, we have also passed the law, and the governor has already signed into the law the state health insurance scheme. And currently, at the state level also, there is increased collaboration between the commissioners of health in the state. Just last week, I was in Kano myself to look at the implementation of the state health insurance scheme in Kano. They have gone very far. Our team were in Oyo State also to look at the implementation of the scheme. In the rollout of the Basic Healthcare Provision Fund, all the states have had to go to all the other states. We've gone to Osun State, we've gone to Abia State. And then also, importantly, what has also been put in place right now is that every year, currently, the surveys are ongoing yearly. In the past, we'll have to wait until the National Demographic Health Survey is out, which comes out after every 5 years. So when you are moving, you don't even know what is happening. But now, through the support of the Federal Ministry of Health and international partners, the World Bank, through the Save 1 Million Life Program for Results, every year, a smart survey is being carried out. And you begin to see how you are improving. So during the launch of these National Strategic Health Development Plan and the implementation of the Basic Healthcare Provision Fund, statistics were brought out and scorecards were brought out for all the states to see how they are doing. And I'm happy to say here that Niger State was among the 13 states that also has shown significant improvement in terms of the skilled birth attendant, HIV/AIDS, contraceptive prevalence rate, and we were given funds for that performance. We were able to gain about $6.4 million for us to go and implement. Yobe State, the national champion, is getting about $28 million. All the states in the countries at various aspects are getting additional funds based on how they have improved. So every year, it's like every year there is going to be an examination. So this is going to is changing the game. And in terms of coordination, I've also said each state is also expected to provide additional counterpart funding. In the past, not that fund will just come to you. All the 6 states where this implementation is taking place in the beginning have had to put down 100 million naira to ensure this happens.
I'm sorry, Dr. Jibril. Let's pause you here and very quickly again bring in Dr. Chris Otabor. Dr. Otabor, the strategic health plan phase 2 and the basic health care provision fund, what do this mean, for instance, to the private healthcare providers? How do they key in? What does it mean? Because you had a lot of patronage from the private sector.
Thank you very much. I was going to say that even if you didn't ask me. Yeah, because there are 2 layers of people that must be on board for this plan to work. One is the private sector, which the government avoids to a very large extent. It's just recently that people are beginning to talk about the private practitioners. They see almost 70% of the Nigerian population, either at primary level or mostly secondary and tertiary level. You know well that I have a rich private sector experience. And based on my position in the private sector, I have not heard anything about this. And the Guild of Medical Directors, the private practitioners, doctors, they are not mobilized to engage in this conversation about the health plan and the basic health support fund. And they are the ones to treat the patients. The second layer is the local government. The local government is where the people live. And that's where you have the poorest of the poor that is supposed to be targeted. But at the local government level, there is paucity of human resource for health. There's paucity of technical skills. The leadership at the local government is so weak. And if we're going to get results from this plan, we need to strengthen the local government and to make sure that they are battle ready to take care of the health of Nigerians under this plan. So I thank God for the Honorable Minister of Health. He's been very dynamic, but he needs to engage the private sector. He needs to assure them, for instance, under the emergency funds, because that's part of it. If people are involved in accident and they are brought to the private hospital should be assured that please treat these people, your money will be paid. So things like that. So not just the private sector generally, everybody needs to be on deck in order to be able to give a level of success to this plan.
Okay, thank you, Dr. Chris. Now I go to Dr. Ifeanyi. So you spoke about so many things, and so as partners of the health sector, you're working together for the implementation of this action plan. So what do you think should be put in place to ensure that it is successful this time around and no stories behind it?
Okay, I think the success of this will really depend on how state governments, take it, what role that they play. Because, for example, I know that the state government are supposed to do some kind of renovation. If they do and provide, those renovate and bring it up to standard, the federal government puts in money. So, which means that if the state government decides that their focus is on something else for this period, well, practically nothing will be done. That's what it is. But again, going back to what's for us in Nigeria Health Watch, we've always said that we want to make health a political issue. Let's bring it to the top burner of the political issues. So we need people. People must begin to hold government accountable. There's just so much that CSOs can do. How many CSOs do you have in the country? So at different states, at local government levels, community-based organizations, NGOs working in those spaces must begin to mobilize people to hold government accountable. Take the example of the Abuja airport. Within a very short period of time, the runway was renovated and brought to international standards.
Well,
why?
What's your take on what Dr. Chris Otabor was saying about the apparent gap between the public policy makers and private healthcare providers?
I mean, he's absolutely right. But again, we can't put that on the federal government alone. Because if you look at the health space, if you look at what percentage of it does the federal government really control, if you look at it realistically. And this brings me back to what I was saying about the state government. At the state levels, to what extent do state governments, engage private practitioners? Because Dr. Otabor is absolutely right about the number of patients that private practitioners see and the fact that they're not carried along in all this. But I also think that the private practitioners are very important stakeholders. They want good health for Nigerians. So maybe they should also push from their own end to ensure that in all these discussions that they are brought into it.
All right, Dr. Sofo, thank you very much. Honorable Minister, let's take a look again at perhaps some other economic aspect of this plan. What, for instance, are the backward integration issues embedded in this plan going forward? Let me put it this way. Facilities will be provided, equipment will be provided, commodities, that is to say by way of drugs and supplies. How much of this will be... How much of this will be sourced locally? And what is the capacity for domestic production or addition to all of this? I'm asking this question because, again, from our national experience, we can outline all these plans, we can have all our plans, to get in drugs, to get in facilities and equipment, and so on and so forth. And then once you have disturbances in the macroeconomic environment, things change. So, what are the underlying economic considerations for the success of this plan?
I think the first thing to look at is, one, we're not deceiving ourselves that the equipment can be sourced locally. They are not produced locally. So many of them will be brought in. But the beauty of it is that they have a long shelf life. That's number one. Two, we are also conscious of the need to make sure that they are well maintained. We are putting resources into biomedical engineering. There's an excellent facility, University of Lagos Teaching Hospital, where we are now using as a base to train biomedical engineers from other institutions. So we're building capacity to maintain the equipment. But then we have a strong pharmaceutical industrial base. And most of the drugs that we use can be sourced locally. So we're quite confident there is an executive order that is facilitating made in Nigerian goods. So we will make sure that that is taken into consideration. So a lot of this money will be retained locally. But then, where we cannot get the necessary material, equipment locally, we'll bring them from abroad. But we're also making sure that at basic care level, at the primary care level, we go simple. We're also going to put a lot of emphasis on promotion, health promotion. We want to educate Nigerians. So there's going to be closer collaboration between the people and the facility. We want to train them. Let them know about simple things. Let them know that when you report early, and something cropped up very early, say we don't value health or we don't, we're saying treat your body better than you treat your car. Because if you treat your body well, the body sends out signals. Don't ignore it. When you wake up in the morning, there is pain somewhere or there is headache, they reflect some things or certain things about to go wrong, already going wrong.
All right, Honorable Minister, let's take this last tweet very quickly, and it's coming from Umbaji. It says, please assess the level of salaries being paid to workers at the primary healthcare level, because most of the states are not complying.
Now we'll go to Dr.
Doctor, yeah, Jibril, very quickly.
Yes, quickly. I will say for this, I'll say in Niger State we are proud to see that the.
What about your other colleagues? Because you are their
Even
chair.
in other
Across the board, what's the synergy between you people
there's
to
a lot
ensure
of,
that it gets off the ground?
There's a lot of synergy. I think that's one thing. I'm happy that we're having these discussions here. And one thing that we'll do is improve information to the people. A lot of changes is taking place in Nigeria, but it seems people need to get more aware of it. The apathy from the past is not allowing people to appreciate the changes that is ongoing. At the state level, like I will still see our state now. For the first time, we have states paying 100% CONHES salary structure for healthcare workers. Despite the recession, despite the challenges, Niger State was able to do that, and we are amongst about 4 states right now in the country that are doing that at the federal level. We have Kano State, Lagos State, Niger State, Yobe State, and more states are coming on board. The challenges of payment of salaries for healthcare workers and when paying for salaries for the state, we've seen significant improvement from when this government came in, when most of the states could not pay salary. But now, at least maybe only 1 or 2 states are still having challenges. So we'll say a lot is being done. People need to be more aware. Issue of private sector, just to add that, under the NHIS gateway, the private sector services are going to also be paid for the private sector and private practitioners. So they are also involved in whatever is going. And in the steering committees also, the CSOs are being involved right now in the steering committee. At the federal level, the states are being involved. The private sector is also on our steering committee, so they are fully on board.
And we also factor them into the emergency medical services. They are representing on the management structure.
Okay. Well, it's on that note, we'd like to thank all our guests, who have been with us on the conversation segment this morning. First, we'd like to thank Dr. Ifeanyi Nsafo, is Director, Policy and Advocacy, Nigeria Health Watch. Dr. Nsafo, thank you for being with us. We also would like to thank Dr. Chris Otabor, Consultant, Orthopedic Surgeon, and Head of the Surgery Department at Asokoro General Hospital. Dr. Otabor, thank you for being with us.
Thank you for
And also our appreciation to Dr. Mustafa Jibril. Jibril is from Niger.
Yes, not Jibril of Niger. or Sudan, or Jibril of Sudan. This is Jibril of Niger.
Jibril
Yes.
of Niger.
Of Niger State, Nigeria.
Thank you for being with us.
Thank you very much.
And our appreciation also to the Honorable Minister of Health, Professor Isaac Adewale. Always a delight having you.
Thank you so much.
In Nigeria.
Thank you.
Okay. All right, so that's the conversation segment on Good Morning Nigeria. Let's go back down to our sports desk.
Jarrell Miller has been offered to fight Anthony Joshua in 2019. Joshua is still in search of an opponent for his date at Wembley Stadium on April 13th. It had been hoped that Joshua will take on the winner of the WBC showdown between Deontay Wilder and Tyson Fury, but it remains unlikely as the bout between the Bronze Bomber and the Gypsy King ended in a controversial draw in Los Angeles last December. Dimitri Salita, who is one of Miller's promoters, works alongside Matchroom's Eddie Hearn and believes a fight across the pond could be Joshua's break into the US market. Meanwhile, Super Eagles captain Mikel Obi could be in line for a return to the Super Eagles squad in 2019 after he posted a cryptic message on his Instagram page along with a picture of himself in action for Nigeria with the caption, "Can't wait." Miguel has not featured for the Super Eagles since the 2018 FIFA World Cup, where he failed to lead the team past the group stages of the Mundial. The 31-year-old missed Nigeria's last 5 games against Seychelles, Libya, South Africa as well as Uganda, which fueled talks about his retirement from the national team after 13 years. But Super Eagles coach Kenneth Rowe insists that the former Tianjin Tada and Chelsea midfielder remains in his plans for 2019.
Next, it's foreign news.
U.S. President Donald Trump has threatened to declare a national emergency to fund a border wall without Congress approval. The president insists that he has the absolute right to declare a national emergency, saying Mexico would indirectly pay for the wall, and this contradicts an earlier campaign memo. The government has been in partial shutdown for 20 days, leaving about 800,000 federal workers without pay. President Trump has refused to sign legislation to fund and reopen the government if it does not include $5.7 billion for a physical barrier along the U.S.-Mexico border, but budget talks have come to a standstill as Democrats who control the House of Representatives refuse to give him the money. Republican leaders insist that the party stands behind the president, although some Republican lawmakers have spoken out in favor of ending the shutdown. The president said that if Congress did not approve funding for the wall, he would probably declare a national emergency to bypass lawmakers. Now back to Africa. The influential Catholic Church has questioned the official results of the Democratic Republic of Congo's controversial presidential election, which has opposition candidate Felix Tshisekedi as the winner. The church, which posted 40,000 election observers, says the result does not match its findings. The runner-up opposition candidate Martin Fayulu has told the media that he would mount a legal challenge against the official vote count, as he describes the election as an electoral coup and does not reflect the truth from the ballot. He accused Tshisekedi of reaching a power-sharing deal with the ruling party. He claimed the veteran figure has denied. There are fears the result could trigger unrest, with at least 2 people killed in the western city of Kikwit on Thursday. Reports say 2 police officers were also killed and 10 people were wounded, and despite this, most parts of the country appear to be calm. Felix Tshisekedi has promised to be the president of all DR Congolese, saying no one could have imagined such a scenario whereby an opposition candidate would emerge victorious. The French and Belgian governments have also expressed doubts about the election results, and 3 diplomats said the church tallies had shown that Fayulu won the election.
All right, so that's it for us on Good Morning Nigeria today. We'd like to thank you for tuning in. The program returns on Monday, same time, and 7 o'clock, and that's in the morning. Wishing you a lovely weekend ahead. I'm Kingsley Osadolo.
And I'm Jumwe Yusuf. Thanks for your company. Do have a wonderful weekend.